On the topic of health, South Africa has a severe nursing shortage. Despite this, hundreds of qualified nurses are sitting at home, unable to help in clinics and hospitals. Nursing unions say they are unable to be absorbed into the system because of an apparent lack of funds. Democratic Nursing Organization of South Africa President Simon Hlongwane speaks to us now. Very good morning to you. Tell us about this problem and why it's there in the first place.
Well, good morning to you and the listeners and viewers at home. Well, our point is that the main reason why the nurses are not being absorbed or employed at the current moment is poor planning. So the other reasons are secondary, but if there was a proper planning in the first beginning, we wouldn't be in this instance. So we know that the MECs that of many different provinces are telling us they don't have a budget for it. But had they planned beforehand, they would have known by now that they needed to be absorbing those post-concepts. We are talking about nurses that have gone through a training program for 4 years. It's either a degree or a diploma. And over and above that, they have gone for a community service for a year, which means they were employed last year. And they were working for the entire 12 months. Come January, they are told to stay home. So essentially, they are being retrenched. And the bigger problem is that the service needs remain high, and our service demands are growing on a daily basis. And basically, it's due to the fact that the disease burden is growing, as well as the population that is growing. So there's a community, as we speak, that had a nurse in a particular clinic or in a hospital that was there last year, December. But come January, that person was told to stay home, and therefore that nurse and that hand is no longer there. And if we were to drive it home, you look at what the Human Rights Commission has done to go to Tembisa Hospital and essentially investigate the circumstances that led to the 10 babies that died. They found, among the other reasons, was that there was overcrowding, but also there was a shortage of staff, shortage of nurses in that unit, because the number of babies were more than double the number that was required, but the number of nurses that were there remained the same. So essentially, there is a shortage out there, but there is no absorption, and the nurses are not being employed. And we're not talking about a small number here. We're talking about more than 1,000 nurses, with Limpopo being the major culprit for that. We have KZN, as well as Free State and Eastern Cape, but also usually in the Northwest, as well as in Gauteng. So
what a shocking situation, and I believe many of them have even signed contracts with the departments.
Yeah, what happened is that when they have to train and they do community service for the entire time, for the rest of the year last year, there had to be some sort of planning for what will happen the following year, which is this year. It is shocking for us because this serious poor planning happens when it's as if the departments are waking up now and realizing that they don't have money, when they would have known that long time ago, around September, as of last year, and requested money. I know of some other provinces that are saying they are now negotiating with Treasury, but we're simply saying that negotiations could have taken place long ago, last year before September, and they would have known by October that they don't have money or they do have money.
Yeah, I mean, it's a very strange situation. I mean, what are you advising these nurses who, as you say, have been effectively retrenched, clearly not earning any money and sitting at home? What are you advising them?
Well, there are two things that we think we can do in the meantime. We need to actively advocate for them to get employed with the government through the negotiation process. That in all different provinces, there are many processes that are undergoing to that. There's also our attempts to negotiate with private sector as well, to see if they cannot get employment in those areas. So we're advising them to stay strong, but also those who can get employment in the private sector, because we are assisting in that process and negotiating, but also coordinating the list and their CVs and so on. Whoever can get employed, even if it's a private sector, they should be employed, because some of them are breadwinners in their homes, and they really need to be supporting their families in the meantime.
Simon Hlongwane, good to talk to you, and best of luck.